We're back right here on Hala Kuwait, and if you're just tuning in, we're coming to you live tonight from the Ministry of Information Studios right here in downtown Kuwait. And we have with us right now our second guest right here in the studio. We have with us Dr. Fatma AlAwadi, and Dr. Fatma is a consultant developmental pediatrician at Fatma Clinic. Dr. Fatma, welcome to our program, Hala Kuwait.
Thank you. Thank you for having me.
Nice to have you with us right here in the studio. And maybe we could start out, Dr. Fatma, by telling us the meaning of ADHD, please, and a little bit about that.
Sure. Of course, ADHD stands for Attention Deficit Hyperactivity Disorder. And it's a medical condition, and it's one of the most common neurodevelopmental disorders in childhood. It's characterized by three main symptoms, which are the inattention, where the child is not able to pay attention and keep focus, and hyperactivity, where he's overly active with excessive movements, especially that does not fit the setting where he is in. And the third one is the impulsivity, where he cannot control his impulsive behavior, and so he acts without thinking.
Dr. Fatma, now some of these things that you said can fall into, a lot of kids have some of these things in general.
Yes,
so how can a parent who has a child like this kind of get the right diagnosis for them? Can you explain about that, please?
Of course. Many of the kids, especially with the different age stages where they go through, they might be hyperactive or they might be inattentive.
It's a bit normal sometimes.
That's true. And ADHD is usually diagnosed or recognized in school-age children when it causes and leads to disruption in the classroom and problems in the schoolwork. So when it affects the life of the child, being the social life, being the educational life and the school life or at home, then it becomes a problem. And it goes through the process of diagnosing until he is diagnosed with ADHD.
Okay. Is the ratio boys and girls the same, or is it higher in boys, higher in girls? Tell us.
Boys are more affected, about 3 to 4 times more than girls. And there are like...
Any reason for that?
No specific reason, but boys are more hyperactive.
Sure.
So there are like 3 types, main types of ADHD are like the first one, which is predominantly inattentive. And this type is seen and diagnosed more in girls actually, and it's diagnosed later in life. And the second type, which is predominantly hyperactive, and that type is more in boys, and it is usually diagnosed earlier. And the third type is the combined type, where there is inattention with hyperactivity.
So ADHD, you can get it at a later stage in life?
You can be diagnosed at a later stage. But one of the criteria to diagnose is that the symptoms start before the age of 12 years. So sometimes they are not diagnosed, like the inattentive type, where more girls are affected. Usually the inattentive don't annoy anybody, so she doesn't pay attention, but maybe her work is not really affected a lot, and she doesn't disrupt anything in the class.
So they just kind of let it be.
That's right. So she will not be like, nobody will complain and nobody will think of like what's wrong until later on when she starts struggling, like in high school or maybe in the university, and then she starts seeking professional advices and she discovers that she has ADD or ADHD.
And doctor, now for the diagnosis in that, are there blood tests that are being done, or is it a specialist who does some tests?
There is no specific blood test. It's not like any other medical conditions where we take blood and say he has this disease or disorder. It's actually diagnosed by a process of assessment, and assessment including the ability assessment, where we have to make sure that his abilities or her abilities are within the average range or maybe higher than average. So they are actually smart people, and they are normal of intelligence, and IQ is within the average range. And then we assess the behavior itself, and then also we assess the achievement. And then with all of these, we start to thinking of the diagnosis of ADHD. And the main criteria for the diagnosis is that these symptoms are persistent and are occurring before the age of 12 years. And the other thing is that they are persistent. So at least 6 months they have been having that hyperactivity or inattention or together, and then they occur in 2 or more settings. So it's not like he's hyperactive at school, but he's okay at home, or vice versa, or he becomes hyperactive or inattentive in any other places. So it has to be like pervasive in different settings. The other thing is that it affects their life. So it affects their school abilities, it affects their grades, it affects their social interaction, making friends, keeping friends. And then these symptoms are not really explained by other disorders. So at that time, we start thinking of really it is ADHD.
Very well said, Dr. Fatma. And we're going to take a short break and then be back with our distinguished guests. Stay tuned. Well, we're back right here in the studio, and if you're just tuning in, we have with us our second guest right here with us, Dr. Fatma AlAwadi. And Dr. Fatma is a consultant developmental pediatrician at Fatma Clinic. And before we went to that break, Dr. Fatma, we were talking a little bit about the people with ADHD. Tell us more about the positive qualities that they have, please.
Of course, ADHD is the disorder which everybody around him will be complaining of him.
Okay.
So when we look at the positive things, the number one is that they are of normal intelligence. So they are really smart and maybe smarter than many of his peers. So if he is like hyperactive, then he has got energy, he's energetic. If you channel that energy into the right way and towards success, then we will have like somebody like Michael Jordan.
Okay.
And then if he's impulsive, then he is courageous and he's spontaneous and he dares to try new things.
All right.
And that makes him like creative and thinking out of the box, and then you can use that as well.
These are all very good qualities.
True. And then he's inattentive. Inattentive, there are some talks about it because he's inattentive to the details, especially in mental workout. But then he looks into things in a different way, and he approaches the tasks and situations in a thoughtful eye, and then he becomes the creative and the inventive thinker. And with the inattention, there is what we call hyperfocus in ADHD, which is the opposite. And that happens when the child is really doing something which is interesting for him, like video games or whatever. And then he gets into that and sinks into it, and he forgets everything about the whole world around him. So all these qualities, when you take them together and channel them the right way, then I think we will have lots and lots of success stories.
Yeah, I think that's what you said, channel them in the right way. They need a specialist to help them, guide them.
Of course, they need help. Sure. I mean, it's not easy, but then if you look at it, and especially when we talk about like the management, so the management includes so many areas of which needs to be tackled. Sure. So his behavior needs help, so behavior modification programs would be very helpful.
I know that's your mode of, let's say, helping out is more behavioral and cognitive therapy before medication.
Right. Before medication.
So tell us about that, your way of treatment.
So behavior and then cognitive training with organizational skills training, these are very important, and they help the child to develop the skills which he is not able to reach, and maybe which he is less mature than his age. And these skills are very important because these are the skills on the frontal lobe area of the brain, which is the problem-solving area, and it is like the CEO. So the main function of the frontal lobe is like organization, planning, sequencing, and taking decisions. So these are very important, and these executive functions, what we call, they mature with age, and they are the best or fully mature at like 21, 22. But then by 6 years, he is mature enough to understand that I need to sit in the classroom. I can sit and focus with the teacher, but the ADHD does not reach that level at that age. But in later stage, maybe he can reach it. So with the right intervention and help, he can reach these skills earlier than his pace. And medication, of course, is one of the ways we treat or we use to help the kids. And
tell us more about that also.
Medications are the two main types are the stimulants and non-stimulants, which are widely used. And the stimulants are longer time have been used. The non-stimulants were introduced at 2003. And there are good effects. There is about 70% of kids who are on medication, they report that they have less or fewer symptoms. So it does improve, but then with medication we have also to think of the side effects.
Sure.
And there are so many side effects, but the main or two most common ones are the poor appetite, affecting the appetite, and the sleep disturbance.
So in your opinion, Dr. Fatma, what is the most important element in a successful treatment program?
The teamwork.
Okay.
Teamwork, like everybody, all the brains come together and help this child together in one hand. What happens is like parts of the team are there, but then everybody is working sporadically. And what we need is like come together, plan it together, do it together, and you will get the best result out of him.
Very
and they
well
are
said.
really good people.
Sure.
And there are so many successful people who are or were diagnosed with ADHD.
Very well said. And Dr.
Thank
Fatma,
you.
it was a pleasure to have you on
Pleasure's
our program
mine.
this evening.
Thank you very much.
Hala, Kuwait. Any last words or comments for the audience watching this evening?
Yes. ADHD, anybody with ADHD or dealing with ADHD, being a parent or a teacher, they feel like they have a challenge. For me, with the right or with a good approach, you will make it an interesting challenge. So just take a deep breath, take a step backwards, and enjoy the ride.
Very well said, and we
you.
wish you all the best of luck in your clinic, and thank you for coming.
Thank you for having me.
Thank you so much. We
very
are speaking
much.
to
Pleasure.
Dr. Fatma AlAwadi, consultant, developmental pediatrician at Fatma Clinic. We thank her very much for her valuable insight and time with us this evening right here on Hala, Kuwait. And with that, we come to the end of tonight's program. I hope you enjoyed all that we brought to you on this evening's episode. Make sure to enjoy the rest of your viewing tonight and all throughout the week right here on KTV2, the family channel. Before I leave you, remember to always take care of yourselves and each other, and let's always remember to respect one another. Have a nice evening, and good night for now.